Okay, guys, let's get going. I'll have a look at the Instagram first. There's a gentleman there. I'm sorry, I can't pronounce your name. Looks like 𝐓𝐢𝐦𝐻𝐬. I hope I've got that right. We did chat a little bit earlier in the week. I believe you have a product from Block Blue Light. It is a great product, but I can't give specific instructions on other people's products because, of course, they have different specs, different things going on. But 𝐓𝐢𝐦𝐻𝐬 says, when starting off, how long should you do? So it really depends on what your goals are and what you're trying to treat. With our products, it's anywhere from 5 minutes to about 20 minutes. But like I say, it depends exactly which product you're using and what your goals are. Sorry, I can't be more clear than that. Try reaching out to the people that you got your light from, see what they say, let me know what they say, and maybe I can elaborate a little bit more on my own opinion. Kate says, is it good to wear glasses when doing the red light? No, it's not good. I'm not sure if Kate means reading glasses or spectacles, or she means some kind of a blocker to stop the light from going into her eyes. But no, you shouldn't wear glasses because the glass does, it does mess with the light a little bit. So that means you might not be getting as good a dose on your face and in your eyes as you otherwise would have hoped to. Kate is also saying, do you know if red light therapy is good for the thyroid? I do know that red light therapy is good for the thyroid. There's quite a few decent studies on red light therapy and thyroid, and what it does is it seems to help the thyroid balance itself and optimize itself to produce the correct amount of the thyroid hormones. And reduces the inflammation, which improves thyroid health. And when your thyroid health gets better, your health generally tends to get better. I think so. Kate was referring to wearing blockers when doing red light therapy. You don't need to. If you're using your red light device the way we recommend it, then it's perfectly fine for your eyes. And I will get into some more about eyes a little bit later on. I'm sure we'll have some more eye questions. Somebody's asking, does red light therapy contradict any medications? For example, low-dose chemotherapy tablets for blood cancer. That is such a huge, complex question, and unfortunately, I am not qualified to give any recommendations on that. The only recommendation I say is that you would, if you're using red light therapy and you have active cancer, you need to tell your healthcare provider. The chances of them knowing about red light therapy are unfortunately very low, but ask them to do a quick Google, and if they refuse to for some reason, do a little Google yourself, red light therapy and contraindications for medications or red light therapy and cancer. There's a little bit of good news out there about red light therapy and cancer, and there is a little bit of warnings about photosensitive medication and red light therapy. So that might not apply to the chemotherapy tablets, but there's a little bit of content out there for sure. I'm sorry I can't, give any more advice when it comes to red light therapy and cancer. Is it good to do in clothes or without clothes? That is the absolute basic red light therapy question. That is the first thing anybody asks. And yes, when you're doing red light therapy, it's absolutely better to be naked. And the reason for that is because you want the red light therapy on your skin. You want it on your face, you want it in your eyes, you want it on all over your body, your muscles, everywhere. Because red light therapy does its best work when it gets absorbed by the skin and absorbed by your cells, and then all the benefits come down after that. So absolutely, as naked as the day you were born is the best way to do red light therapy. Simon Kitchen is asking, can red light therapy help the lungs? Absolutely. So how red light therapy works is it actually, what's unique about it is it penetrates your body. It penetrates your skins, your muscles, your bones, your organs, and it goes into your lungs, it goes into your heart and all the other goodies that are down there. And it helps reduce inflammation in the cells of the tissue, and it helps increase energy production in those cells as well. So yes, the light will help the lungs. I mean, it depends what's wrong with the lungs. You know, of course, there's red light therapy is not a miracle maker. It's not going to, if you've got a major malfunction with your lungs, it's not going to, you know, come right overnight, as it were. But what I have seen actually is a lot of great studies on people suffering with long COVID or inflammation of the lungs after COVID, or inflammation of, they call it, you know, the upper respiratory tract. Red light therapy has been very, very useful to decrease the inflammation around the lungs or the respiratory tract area, which helps people have a better quality of life and have less symptoms of long COVID. 20 minutes straight. Okay. 𝐓𝐢𝐦𝐻𝐬 said he went in 20 minutes straight. Again, I don't know the context of what you did, or, you know, how far you were from the light. And like I said, I don't know the specifications of the light you're using. But get hold of Block Blue Light and see what they say and let me know. After a hip replacement, what's the best way to use the red light? Is it safe to use near a scar? Yes, absolutely. So when it comes to a hip replacement, in particular, the light that I actually recommend for that, the best one, it also happens to be one of the cheapest, is the good old Target Light 2. Now, this is one of our best sellers, and it's one of our best sellers because it's small, it's handheld, and it is incredibly powerful. So you can see by the size of this, you can hold this right up onto your hip bone. You can do the front of the hip, the side of the hip, and where the incisions were and all that. You can touch this right to your skin, and you can do 5 minutes per area over that hip replacement, and that will speed up the healing. It will reduce the pain and hopefully get you back on your feet in no time. I hope that helps, Mickey K. Okay, here's a great question. Okay, for those of you that don't know, the Target Light 3 has 3 settings. It has red only, near infrared only, and the combination of the red and the near infrared light together. And you control that, can't quite see it there in the screen, but you control that by the switch that comes with the cable. Okay, so when you first switch on the light, this is the red and near infrared together. Okay, you can't tell because it obviously just looks bright red, so you can't see what's going on, but this is the sequence. So it starts with red and infrared together, and you switch it off, you switch it on again. Now it's red light only. Again, you can't unfortunately tell because it's so bright, but then you switch it off, you switch it on again. Now it's near infrared light only. So you'll notice that difference there. It's showing up on the camera, but there's obviously no bright light like there was with the other settings. Okay, and that's the sequence. So after this near infrared, which is virtually invisible, you switch it off, you switch it on again, and then it's the combination of the both. It does sound a bit complicated at first, but we do have written instructions, obviously, so it's quite easy to get your head around. Now, which one is best to use and when? Okay, there's a little bit of literature out there, and there's a little bit of discussion in the community about when you use red light and when you use near infrared light, and when do you use them both together. Now, my advice to everybody who uses red light therapy, regardless if it's our products or someone else's, always use red and near infrared light together. The reason is because they both give you benefits. They're both very good for you, so you may as well use them both all the time. The red light is generally for the skin and the eyes. So the red light does the outside of the body. Okay, and the near infrared light goes deeper into the body. That's what will go into your joints and your muscles and your bones, your brain, your lungs, all the things that are on the inside of your body, but they both do the same thing. They help the cells produce more energy, and they help the cells reduce inflammation. So when you use red and near infrared light at the same time, you're getting those benefits, but on different levels of the body. So you're getting them inside the body and the outside of your body. I I hope that makes sense. So for most people, most situations, you use the red and the near infrared together all the time. There's another great question. Is red light known to make you tired? I'm thinking of starting my day with red light. Any benefits to that? I feel like it's more for night as it makes one a little tired. So this is a great question. Can you use red light therapy in the morning to feel awake and energized? Or should you use red light therapy in the evening to make you feel sleepy and tired? As you can see around me, I've got a little bit of ambient red light for this exact reason. Okay. Now, red light in the morning is actually very energizing, and red light in the evening will make you feel sleepy. And now I know that sounds confusing, but one of the reasons why I believe it works like this is because in nature, generally, if we were, still living in the forest, as it were, or we were still hunter-gatherers, or you can think of it as how we've evolved over the millennia, when the sun comes up in the morning, you get your red and infrared light as the sun is coming up. That's when red and infrared light is highest in nature, as the sun is coming up. So you get that red and infrared light, then you get bright light. And when you get red and infrared light followed by bright light in that order, your body knows that you've woken up, there's been a sunrise, now there's bright light, therefore the daytime hormones kick into action and you should feel alert, awake, and energized. And then the other side of that coin is the evening, when your body and your brain perceives the red and infrared light of the sunset, which is another high point of natural red and infrared light in nature. Your body perceives that and then perceives a level of a state of low level light, as in sunset, darkness, nighttime. Your brain and your body knows that red and infrared light followed by darkness is actually bedtime, and that's why it makes you sleepy. So that's why you can feel energized with red light in the morning and sleepy with red light in the evening. I hope that makes sense. That was for Shireen or Kareen on Instagram. Just let me know if that didn't make sense, or you can ask more questions. Do I think red light therapy is good for osteopenia? Not only do I think it's good, I absolutely know it's good because I've read several scientific studies that have found good results with osteopenia. And I also have a fantastic testimonial from one of our older clients that had osteopenia, and osteoporosis, and he managed to reverse his symptoms with 1 year of red light therapy. And while I'm on the subject, I'm going to post a link to that testimonial because it's good to see. It's quite an old one already. Sorry, guys, just give me a second. Okay, this is it. So this is a YouTube link, and this is a testimonial that a client of ours gave us, a video testimonial. Memory serves, he actually gave us his scans. He showed us his DEXA scans, and it showed that within a year, he'd gone from having osteoporosis and been downgraded to whatever level, is considered non-osteoporosic, as it were. So anybody that's suffering with that osteoporosis or osteopenia, have a look at that link in the YouTube. Let's see. Now there's more questions than I can handle, unfortunately. Oh, Kate says she told 2 people about our company. Very kind, Kate. Thank you so much. I appreciate that. Amy's asking, do we sell any face creams to apply that work well with red light? We do not. It is something that I've thought about and wanted to investigate, but at this stage, I'm literally a little one-man band, so I just don't have the time to do the research on that. But any face cream that's high in antioxidants will work. There's a lot of people that are. Some people say it's fantastic to use antioxidant face cream after red light therapy. Some people say you don't need it. I haven't studied it myself, so I'm not sure, but there's definitely some content out there you can look for. Great band, Amy says. One man band. It is a good band name. Amy also asks, red light and methylene blue. I know a lot of people that I respect love methylene blue. I've never had it myself. I don't know. I just can't get over the blue mouth and the blue tongue. I just think it's a bit of a gimmick. But again, I haven't researched it myself, so I'm not too sure. But a lot of people I trust use methylene blue as putting it together with red light therapy. I'm a little bit skeptical about doing too many hacks at once. Okay, and this doesn't really apply to methylene blue, but when oftentimes people want to do, they want to take their sauna, then they want to do their ice bath, and they want to do red light therapy, then they want to fast. I think doing all those things too close together of a morning or of an afternoon is not a good idea because they're all quite taxing on the body. So it's a bit silly. Amy says she's taking methylene blue for Lyme. Ooh, fantastic. As I say, it is something that I should really catch up with, but every time I open the internet, there's a new biohack that I need to research. Okay. Does anybody experience stomach pain after starting red light therapy? Not that I know of. I've never had it reported to me. I've actually have a lot of people that use red light therapy to get rid of stomach pain, especially if if it's the ladies and it's that time of the month. It's fantastic for the cramps around there. And also personally, if I overindulge in some food or some food that I'm not supposed to eat and I get upset stomach, the red light therapy really works great on the belly, actually. And this is a device that, if someone was using it on their stomach or using it for cramps, this is our red light therapy wrap. As you can see, it's flexible, and this goes right around the belly, and it's super easy to use. You can obviously tuck it underneath a t-shirt. You can wear it under your PJs in bed. You can use it in the car. It's really a remarkable little piece of kit. What other questions have we got here? Julie on Instagram is asking, with or without glasses? Without glasses. It's always better to have natural light in your eyes. Ellie on Instagram is asking, which unit is best for full body? Okay, now this is exciting. Well, the full stack is the best one for the full body, actually, if I just cut to the chase, because it's the biggest. So when it comes to red light therapy, you actually want to get the biggest light you can justify. So unless you come to me and you say, look, I've got wrist pain. I've got wrist pain in my right wrist. That's all I want. Then I would say get the Target Light 2 or get the pad, because you can treat your wrist directly, happy days, and you can get on with your life. But what actually happens very often is that people will start with a cheaper device, totally understandable, and then they're blown away by the benefits, or they're blown away by the effects. Then they come back and they buy a bigger light. And then they come back and they buy two lights because now they want to expand their setup. So when it comes to red light therapy, bigger is better, because the more of your body that you can cover every time you use red light therapy, the more of your cells will get penetrated by the light, the more energy they will absorb, the more cellular energy they will produce, and the more anti-inflammatories will go into your bloodstream and help decrease your inflammation. So if money was no object or space was no object, I would say get multiple large panels so you can make yourself a big panel. You can fit it on the wall, you can fit it on stands, and that's the absolute best red light therapy full body setup. Iron Mac Fitness, is there a distance that you have to be mindful of? Not really. It depends how you're using it. There's always a little bit of nuance. We do provide all our clients with something new that I've written, which is called One Protocol to Rule Them All. And this is a 2-page PDF document where I explain my opinion on how to do red light therapy for everybody. No matter what, condition you have, no matter what goals you're after, this one protocol will suit almost everybody. We did have it on our website, but now it's only available to clients. And I know Iron Fitness is a client. So if you could just drop me a DM after this call or at some point on Instagram, I will send you the link to that protocol. And that'll answer your, well, I guess I'll answer the question as well. It was a roundabout way of doing it. No, there isn't. Underneath your chin, you don't need to worry about distance at all. It's my opinion that you should be as close to the light as possible to get maximum absorption into your body, into your muscles and your organs and your bones. From the chin up, the face, I recommend everyone start with at least arm's length away. This is to make sure that your eyes aren't overwhelmed by the brightness and you can get a nice treatment on your face. So that is the protocol in a nutshell, and there's nothing to be concerned about with distance. Okay. Looks like Benjamin Pitt. Does red light therapy help with sports injury? Absolutely, 100%. Don't delay another second. Get red light therapy if you've got a sports injury. This is one of the biggest, most important topics that is studied in the red light therapy research area. And it's sports injuries or injuries, because getting injured can obviously ruin the quality of your life. And if you're an athlete that relies on your sports performance to make a living or just to have a good time, injuries can cost you a lot of money and can, ruin your dreams, as it were. Red light therapy is phenomenal at helping athletes recover. It helps athletes recover not only from the sport itself and from the workouts and the training, it also helps you recover from injuries and reduces the likelihood of further injury in the area. This has all been documented. There are research studies out there. We actually produced a very, very dense PDF that lists all the greatest studies on red light therapy and sports injuries. If you drop us a line, I can dig out that PDF and send it over to you. Ian Mac is asking, if red light is more for skin and IR is deeper, how do you best manage distance when you're using it? The truth to that question is no one really knows, because when you're using red light therapy at a distance, you're getting a very, very gentle treatment. So that's when you can think to yourself that I'm getting a skin treatment. So when people use full body red light therapy and they stand 12 inches away or even more away, the further away you are, the weaker the light gets. And the weaker the light gets, the less it penetrates into your body. So if at a certain point, it becomes only a skin treatment, whether it's red or near infrared light. Now, when you stand close up to the light, that's when you can get maximum penetration into the bones and the muscles and the organs. So it's the near infrared light that's going to go into the bones and the muscles, and it's the red light that's going to go into the skin, because it doesn't go deeper than that. So in that situation is when you could reasonably expect to be getting a skin treatment on the outside and a deeper tissue treatment on the inside. It's an interesting question, and it's very complicated, and no one really knows the answer. But that's the best way that I understand it, and that's the way that most people are getting benefits with it. Sorry. So Kate is asking, just to confirm, when I start the full stack, I use the red and the near infrared switch at the same time. Yes, absolutely. Both switches, same time, every time. Shireen is asking, can you expand on the best way to use red light for osteoporosis? Yeah, you just have to get exposure to the red light. If you know exactly where your osteoporosis is, which I think is usually in the hips and the lower back, you could use the small light and treat that part of your body, but it's a bit tricky. My great success story was with Greg was he used 2 full stacks on a stand, and he stood in front of them every day, turned around. I think he did 10 minutes on each side. So he treated as much of his skeleton as he could. And, his results show that he got, he lost his osteoporosis diagnosis. His bones got denser. Does this help with cervical neck pain from whiplash? This is Becky asking this. I'm not sure if Becky's on the call with us, but yes, it absolutely does. And it's funny because I've got another fantastic testimonial of an older gentleman who suffered with whiplash for, I think it was a decade or near a decade. And red light therapy got rid of his whiplash, I think he said, in a couple of weeks. So again, while I'm remembering that, I'm going to post a link to that gentleman as well, because that is always nice to share with people. This is for whiplash. So if anybody out there is suffering with whiplash, listen to Mike's story. So back to, so yes, it helps with cervical neck pain from whiplash, absolutely. Becky also asked, can this help dizziness and eye issues since car accident? And if so, what product is the best for this? I can't really comment about the dizziness. Dizziness is quite complicated. I've not personally had any success stories repeated to me, so I fortunately can't talk about that. But eye issues, 100%. Red light therapy is so good for eye issues. I was just reading a report from someone today. He's had phenomenal results with his eyes. He's started seeing color for the first time, in who knows how long again. And he's actually quite shocked because he was doing red light therapy for something else, and his eyes suddenly got better. So he's very excited about that. But I've had plenty of stories from my clients where they stop using their glasses, they stop the dry eye syndrome, they stop the blurred vision, they can see better at night, they can see better colors. And depending on what's happened to your eyes, at the very least, what I can say is it'll help your eyes recover. It'll help your eyes strengthen, and it'll help your eyes do their job better. And that could result, like it does for many people, in happier eyes, healthier eyes, better vision. Guys, there's so many more questions to get through. I wish I had more time, but I'm going to have to cut it off there. If I didn't get to your question, I'm so sorry. You can contact the company. You can contact me. If you go on our website, there's a little WhatsApp button. You can just hit that button, or you can send us an email. We do our best to answer these questions. Something that might help, because I've got so many questions here, I'm going to share something else, which is a great resource. And this is our latest guide to red light therapy. Well, it's an ebook, so it's got a lot of information in it, but this answers a lot of questions, which I might not have got to today. So give that a bash. One last question here. So Dale is asking, can you please explain what you mean by the full stack? The full stack is just a name of one of our products, Dale. It's we've got very small products like this, and then we've got products that go up in size. And right now, the full stack is a very large panel. It's 1.2 meters tall, and it's our biggest panel that we offer for now. So that's what the full stack is. It's just a product name. Okay, thank you, everybody. I hope that was useful, and I hope to see you all soon on the next one. Have a lovely evening and good night.